how do you know if your body is ready for a baby carrier? A lot of new moms think that they're actually protecting their body by wearing the baby versus just holding them the entire time. But actually, a baby carrier can put a lot of strain through your body. So how do you know if your body is ready for a carrier? What I would tell you is refrain from using the carrier for the first few weeks postpartum. Now, if you are just sitting around and you want to wear your baby in a wrap and you want to just be nice and close, but also have your hands free, totally good with that. That is fine. If you are going for a walk, my preference would be that you have your partner wear the baby or the baby is pushed. That extra load on your body when you are walking in those first few weeks postpartum can really start exacerbating some symptoms. It can increase your blood loss. It can actually create a prolapse and make that prolapse a little bit worse. So in those first few weeks, it's a safe assumption you should just avoid movement with the baby carrier. Now, after those first few weeks, you might be a little more eager to start wearing the baby more, start being ready to get some things done while holding the baby. So how do you know if what you're feeling is normal? So when you're wearing a baby carrier, you should really feel no strain in your lower back. So if you've worn the baby for an hour and you start to feel like, okay, my back is achy, this is my limit, you're probably wearing it incorrectly, or you don't quite have that core strength yet to support the carrier. So you would want to decrease that length of time that you are wearing the baby and keep it in a range that is totally symptom-free. When you wear the baby, you should really feel the load right here. You should not feel any pulling from your lower back. So if right off the bat you're feeling a pull right through your lower back, think about lowering that hip strap and getting it to catch right on the top of your hip bones. So lower it down, make it nice and snug. A common error that we see is snapping that hip strap right around your belly. So get it lower, as low as you can, and that's really going to take the strain out of the back. Now, if you are a new mom and you are trying to decide what carrier to use and you want the most support, I would stay away from a wrap carrier. You are not going to get as much structured support in those carriers as you would as a carrier that has a nice thick hip strap. So really look for ones that have those hip straps if you are planning on wearing baby while doing activity. Another symptom that you really want to avoid is any heaviness in your pelvic floor. So if you put that carrier on and you feel some bulging, like something is going to fall out of your vagina, any of those things, whether it be immediately or after 10 minutes or 5 hours later, you're feeling an increase in those heaviness symptoms, you want to be really cautious with that carrier. Again, it should not create or recreate any type of symptoms at all. It should actually be unloading your body. So again, lower those hip straps, make sure that baby is really snug to your body. So if I lean forward, baby should really not fall off my chest at all. Okay, so remember, those straps in the back are there for a reason. Adjust them and pull them really, really tight. Baby needs to be snug. Then you should also be able to tilt your head down and kiss baby on the top of the head. If baby is sitting down here and you've got to really stretch your head, he is too low. So lift that baby up by tightening up these straps at the top. Questions about a specific carrier? Don't hesitate to reach out to us and we can guide you on how to adjust that carrier.